Hi there, you're welcome to RX Care channel where we talk about medications and how to use them properly. If this is your first time on our channel, make sure you hit that like and subscribe button down below. That way you can get alerts anytime we post our other educating videos and content here on our YouTube channel, as well as be able to support our community here at RX Care. All right, so let's go ahead and talk about our medication of choice today. A medication of choice today is known as lithium. So lithium is a medication that's used as a mood stabilizer, and it's used in patients who have bipolar disorder, patients who have depression. So usually in depression patients, this medication is used as an add-on agent in those patients. So usually patients will have another medication for their depression, and then they can add lithium on if patient have other symptoms or other condition that might be able to let them benefit from the lithium therapy. So with lithium, the regular dose or the common dose that patients normally take is about 300 milligrams 3 times a day. Keep in mind that this dose might vary depending on what your doctor is treating. So let's talk about our side effects. So side effect of lithium includes diarrhea. This medication can cause nausea as well as hand tremors. It can cause weakness and as well as increased urination. It can cause dehydration in patients. It can cause increased thirst as well as abnormal heart rhythm. It can also cause hypotension, which is low blood pressure in some patients, as well as muscle irritation, dizziness, and vision changes. So these are common side effects that patients have reported in the past while taking the medication. Keep in mind that this side effect might not happen to everyone that's taking the medication. This is just a compilation of what they've seen based on research on this medication. All right, so what are some serious urgent side effects that you need to report to your doctor immediately when you start seeing them? So these serious side effects include seizures, as well as, like I said, the ringing abnormal heart rhythm. This medication, some patients have also reported ringing in the ears. So if you start feeling these side effects, then you want to make sure that you're reaching out to your doctor immediately. As well as a fast or pounding heartbeat. If you start feeling any lightheadedness, tiredness, unusual weakness, or a severe lower back pain, a blurred vision that's very consistent, as well as skin redness. And also patients may also notice a rare side effect of which is diabetes insipidus. So this is a mild form of diabetes that some patients may see, and this condition may be reversible depending on what is causing that diabetes insipidus condition. So what are other things that you need to know about this medication while you're taking it? So this medication may be taken with or without food. Just in case if you start feeling any stomach upset while you're on this medication, then you want to go ahead and start taking it with food in order to decrease that stomach side effect. So for patients that are taking the oral solution, if this taste becomes unfavorable to you, then you can mix that oral solution and you can dilute it in another flavored drink or fruit juice. You want to make sure that you're not adding any additional extract to this flavored juice or fruit juice in order to not let it interact with the medication. Also, with this medication, if you're taking the extended release form of it, then you don't want to chew, crush, or break the tablet in half. With this medication, as I mentioned earlier, a common side effect is increased urination as well as dehydration. So while you're on this medication, you want to make sure that you're drinking plenty of fluids in order to avoid dehydration. And also you want to make sure that you're taking salt and eating a normal diet while you're on this medication. This medication is known to decrease salt in the body, and you want to make sure that you're taking salt with your regular diet in order to replenish the salt that is being wasted with this medication known as lithium. Also, this medication can cause dizziness or drowsiness. So if you are going to be involving yourself in any activity that requires for you to be mentally alert, you want to make sure that you understand the side effect and make sure that this medication doesn't cause that before taking that medication while you're doing your regular daily activities that require you to be mentally alert. Also, this medication is not recommended in patients who are pregnant or breastfeeding. So you want to make sure that you're having this conversation with your doctor to make sure, if at all, if the risk is, or if the benefit is outweighing the risk in any case whereby this medication might be prescribed to you. Also, with this medication, the effect of the medication may take about 1 to 2 weeks. So you have to make sure that you're diligently taking this medication as prescribed in order for you to start seeing the effectiveness of this medication while you're on the medication. Also, you want to make sure that you're avoiding overexposure to sunlight as well as overexposure to heat when you're on this medication. This medication comes in different forms, so you want to make sure that you're not switching in between those different forms of tablet while you're on the medication in order to not affect or disrupt this medication regimen. Also, in patients that are taking diuretics or medication known as ACE inhibitors such as lisinopril, ramipril, benazepril, these patients want to make sure that they're using caution while taking the medication, as this diuretic already has a side effect in terms of their minerals in the body, making it causing increased urination in this patient. So now you're taking a lithium medication that can also cause another extra urination in patient. So you want to make sure that you're looking out for those side effects and using caution if you are taking diuretics or those ACE inhibitors that I mentioned earlier. All right, so these are all the tips that I have for you today regarding how to take this medication effectively and safely. If you have any other questions, please be sure to check out our website at www.demyrxcare.com. Thank you, and if you haven't yet done so, make sure you hit the like and subscribe button down below. That way you can get alerts anytime we post our other educating videos on our channel. And also, you'll be able to help support our community here at DemiRx Care. Thank you for watching and stay blessed.